A startling fact from the Indiana Department of Health: men in Indiana die from heart disease at a greater rate than those in the U.S. overall. And we wanted to know more about this trend. So today we have Dr. Srikanth Penumetsa, an interventional cardiologist from Deaconess, here to talk about what this means for you and me and people that we love. So, Doctor, thank you so much for being here. We appreciate your time today. Why does Indiana have such a high rate of men dying from heart disease? What's different about Indiana?
Yeah, I mean, if you look at the risk factors for people to develop heart disease and heart attacks, we generally classify them as modifiable and non-modifiable risk factors. There are some risk factors such as genetics, and being man, is a risk factor in itself for people to develop heart disease. And age is a significant risk factor for people to develop heart disease. These are things that you have very little control of, no control over. And then there are other risk factors which are modifiable risk factors such as smoking, obesity, diabetes, high blood pressure, which we have control over. We can modify them and take care of that and influence the risk of heart disease in a positive way. In this region, my observation has been that there's our obesity rates are very high. I've seen some people in their 40s that are really obese. Our smoking rates are very high. So I think those are the factors that I've seen in my experience here that increase the risk of heart disease.
So it sounds very lifestyle-oriented, what you're talking about.
A lot
here.
of it is, yes.
Are you surprised to see this in southwestern Indiana? And
no, I've seen some regional variation in lifestyle, that increase the risk of heart disease. For example, in places like California, for example, the lifestyle is better, the risk of heart disease is lower. But in this region particularly, I've noticed that the unhealthy lifestyles that increase the risk of heart disease are particularly high among younger people.
Why does it seem that men are more susceptible to this than women?
It's an observation. There's probably hormonal makeup in younger women in the reproductive age that is protective against heart disease. But it is a significant observation that male gender increases risk of heart disease. I'm not sure that there is a specific reason that I can put my finger on, but that's a consistent observation.
And even though I said that, it's important to note that women need to be careful too. And they need to look for the signs and symptoms. And let's talk about those signs and symptoms. What do you look for as symptomatic of heart disease?
Yeah, so when people have heart attacks, it is common that people sit at home presuming that the chest pain that they're having or the burning that they're having is more from acid reflux. That is a very common reason for people to miss a heart attack. So chest pain is a typical symptom that people have when they have a heart attack. It is not uncommon that a lot of people have jaw pain and neck pain, left shoulder pain, upper back pain, or severe shortness of breath, or just an episode where they are just profusely sweating and feel lightheaded. These are all the different symptoms for people that people have when they have a heart attack. Not everybody has the typical symptoms of chest pain that are described.
Right. Well, preventing heart disease, you just mentioned a lot of things, lifestyle-oriented, where diabetes, inactive. What should we be doing to correct this and not be so susceptible to heart disease? Yeah,
we got to pay a lot of attention to the modifiable risk factors that I mentioned earlier, and a huge part of it is lifestyle.
Right.
Eating healthy, exercising regularly, trying to maintain a healthy weight. Not smoking, and taking care of health conditions such as high blood pressure and diabetes and high cholesterol. These are pretty much, most things that we can do to try and prevent ourselves from having heart disease.
And at what point do you need to see a doctor?
So one of the strengths, I think, of our health system is primary care and our ability to prevent disease. So it is totally reasonable for anybody over the age of 40 to see their primary care doctor regularly and get certain screening tests done to make sure that their cholesterol levels are fine, make sure that the blood pressure is well controlled, make sure that they don't have diabetes. And then, of course, things such as eat healthy, exercise regularly, don't smoke, things like that.
All those things that we do have control over is what we need to do.
That's
All
right.
Doctor, thank you so much for taking some time today and kind of shed some light on this. Hopefully we can turn this around and not have such a high rate of men at risk here or even susceptible to death here from heart disease. And thank you for your time today, and hopefully we can convince the folks to get active out there.
Thanks for having me here. It's a pleasure.
All right. Thank you so much. Appreciate it. Dr. Penna-Mensah, we'll be right back.